In my presentation today at the meeting, I discussed, amongst other bulbar disorders, a problem which affects many women called lichen sclerosis. And lichen sclerosis, unfortunately, is a disease for which there is no definite cause or etiology. It's suspected that it is probably an autoimmune disorder, and it can afflict any woman at any age. It seems to occur most often in elderly women, although I've seen it in children, teenagers actually, and young women as well. The principal symptoms of lichen sclerosis are intense pruritus or itching, and this leads to secondary infections on the skin. You can imagine that going to bed at night becomes a nightmare for these people because they virtually scratch all night. And the warmer it is under the bedclothes, the worse the itching becomes. And on physical examination, the typical findings are pallor, adhesions created by the inflammation, which is secondary to the lichen sclerosis. So virtually the labia minora are wiped out and fold into and scar into the labia majora. The clitoral hood undergoes adhesions, and clitoral phimosis can occur. So there are a lot of deformities that result also from the lichen sclerosis. The goal of therapy is to relieve all symptoms. If the symptoms of itching are gone, then the disease does not progress. The typical treatment is topical steroids in the form of clobetasol, Mycolog, or other strong steroid drugs. The problem with the topical drugs is that over time they will themselves create atrophy, which is part of the problem with these people's vulva. And therefore, we have tried and written several papers on subdermal Decadron injections. This works very well. Patients come back into the office every 2 months for a subdermal Decadron injection in the areas where the lichen sclerosis are most severe. This virtually relieves their itching and eliminates the need for the topical drugs and prevent further progression of the disease. All persons afflicted with lichen sclerosis should be told that the disease cannot be essentially reversed. The idea of the treatment program is to stop progression. Another fact that all patients should know is that there is a risk of invasive cancer associated with lichen sclerosis. This is a squamous cell carcinoma, not HPV induced. And the tending physician must carefully watch the lichen sclerosis for any changes and have a very low bar to perform a biopsy so as to diagnose any squamous carcinoma early in its course.